without face covering in public, and stay home as much as possible. Remember, if you have symptoms of COVID-19, such as fever, cough, and shortness of breath, call your healthcare provider to discuss testing and symptom management. Do not go to the emergency room unless you have a true medical emergency. If you have to call 911, tell the operator about your symptoms so that responders can take the appropriate precautions. If you are sick with other symptoms, please call your healthcare provider to discuss a treatment plan. Don't wait too long to call your doctor's office if you are ill. When we say stay at home when you are sick, we mean if your symptoms are manageable at home. Please stay home until you are 7 days since symptoms began and all other symptoms have improved for 72 hours. Make sure you're fever-free without the use of medicine that reduces fever, whichever is longer. So that's 7 days or it's 3 days fever-free. If your symptoms are worsening, call your doctor's office. We want you to seek medical attention when you need it. The Tulsa Health Department so far for this week has about 400 specimen collection kits available to continue to provide specimen collection for symptomatic individuals who are underinsured or uninsured, who do not have an established healthcare provider or have been in contact with a confirmed case. Additionally, testing is available for healthcare providers and also for first responders. Anyone who meets this criteria should call the Tulsa Health Department at 918-582-9355 for a phone screening and to schedule an appointment. We have appointments available this week. We are encouraging you to call us if you have symptoms and are unable to get tested. If you have a primary care provider, Tulsa area hospital systems are still testing their own patients. Tulsa as a whole is meeting our testing goals for our community. This method of testing was chosen as the best way to test and care for our residents. So in Tulsa, healthcare hospital systems are testing patients. Tulsa Health Department are testing people who are uninsured or underinsured, so that we have a cumulative number, and most people who need a test are getting a test. We are still projecting a peak of new infections to happen within the next week. This time is crucial for staying home as much as possible and limiting social contact. We appreciate the families who observed last weekend's spring holidays by attending online faith services, family-only egg hunts, and family dinners. Limiting face-to-face contact with others is the best way to reduce the spread of COVID-19. That's the way it was yesterday, that's the way it is today, and that's the way it's going to be for the near foreseeable future. At this time, I'd like to introduce Mayor Bynum.
Thank you, Dr. Dart. Please stand by as we bring Mayor Bynum in. Mayor Bynum, City of Tulsa.
Thank you, Dr. Dart. And I want to start by reiterating what Dr. Dart just had to say, that we are in the critical moment, as all of our modeling shows us this week. Everything that we've done as a community for the last month to prepare and to minimize the opportunity for an overloading of our healthcare system, it all comes into play this week when we expect the daily contagion rate to hit its peak in Tulsa County. That's very important when you think about the overall lifespan of this virus within an individual, because that leads us to the other peak, which we would expect in early May based on the Tulsa Health Department's modeling, which would be the daily hospitalization rate. And so what we do this week, more than any other time, will have an impact on the peak rate that our hospitals receive from daily hospitalizations coming in. So I would ask everyone, I know that we've been enduring this and sacrificing through this for a month now, but this is the critical time. And so please remain patient, remain vigilant, continue to practice social distancing. And if we do that, then we, all of us as a community, will give our healthcare system the bandwidth it needs to process those who need the most urgent medical care. And each of us will play a part in saving the lives of thousands of our neighbors. So I would ask everyone to continue to practice those those social distancing practices that we've put in place and that we've all been trying to follow for the last month. What we see in the data so far that's out there around mobility is that it's working. What we're doing as a community is working, but we cannot let up now. We have to continue what we've been doing. And so long as we do that, we should feel a lot better about the odds of our hospital system being able to handle that peak that we expect in early May. I also want to make sure that all the veterans in our community know that if you would like to get drive-through testing, the Eastern Oklahoma Veterans Clinic is providing that here in Tulsa tomorrow. And you can call to schedule an appointment to do that testing at 1-888-397-8387. Again, that's 1-888-397-8387 for Tulsa area veterans if you want to participate in that drive-through testing that's available for you. A little bit of an update on our team at the City of Tulsa. You know, the most important thing that we do at the City of Tulsa is serve our citizens, and that requires an outward-facing organization. So we have hundreds of city employees who are out in the field every day assisting Tulsans, and with that comes exposure to a lot of potential opportunities to contract this virus. So far, we're fortunate in that we've only had one city employee who has tested positive, and that employee is recovering well. I'm very grateful for that. But as of today, we have 45 different City of Tulsa employees who are quarantined and under observation by our city medical staff to make sure that they're safe and healthy and can get back to work in a safe period of time. Also at the City of Tulsa, we are not immune to the economic impacts of this virus. And we are projecting as of today to end the year about $2.7 million behind where we were budgeting for. It would be a lot worse if we hadn't had a very strong first 3 quarters of the year. But everything that we see from an employment standpoint, from a crude oil standpoint, and so many other indicators that we utilize to determine what our sales tax revenue is going to look like shows that it's going to be a very difficult final quarter from a revenue standpoint for the city. And that's what funds our police officers, our firefighters, our crews that go out to work on our streets. It's important for the citizens of Tulsa to know, though, that the City Council and I have been very diligent over the last several years in building up our rainy day fund. And if ever there was a rainy day, this is it. And so we will be utilizing that over the balance of the year, we would expect, so that you won't see a reduction in law enforcement personnel out there or fire personnel. We will continue to make this a safe place for you to live and do business. But I will present the upcoming year. At the City of Tulsa, our fiscal year ends June 30th. Our new one starts July 1. I'll present next year's proposed budget to the City Council next Wednesday evening at 5 p.m. And that will continue what we would expect to see right now with a very difficult financial picture. One that those of us who were around for the Great Recession haven't seen anything really since that time. And it will require sacrifice from us at the City of Tulsa, but we will continue to provide the most critical services for Tulsans so that you, again, can have a safe place to live and recover as we get out of this pandemic event. The last thing I would like to remind everyone about, we're in a critical week as it relates to COVID-19, but we're also getting into tornado season. We're just shy of a month from, just about almost a year away from the flooding that we had in May of 2019. And I would ask everyone to please be weather aware. I can't remember the last time it was this cold in the springtime in Tulsa, and yet that's what we should expect from a weather standpoint here in Oklahoma. And so while we're all focused on avoiding contact with others and practicing social distancing so that we can get through this peak contagion rate of the virus, we also need to be mindful of those natural disasters that we're more accustomed to dealing with. And so I'd ask everyone, I think most of us probably know this already from experience, but if you don't have a place in your home that you've identified as a safe place to go in the event of a tornado, please go ahead and use this time to find that location and keep your eye on local weather reports and be prepared as we move into tornado season here in Tulsa. That's all for me. I'd like to turn it over to County Commissioner Karen Keith.
Thank you, Mayor Bynum. Please stand by. County Commissioner Karen Keith. I'm sorry. Commissioner Keith, could you please unmute your microphone?
There we go. Sorry about that.
Thank you.
Yeah, Mayor, thank you for your comments. Yesterday, the Board of County Commissioners extended the restricted access to the courthouse for another 3 weeks until May 4th. We believe it is in everybody's best interest to keep those restrictions in place, and we continue to urge all citizens to conduct their business by phone, email, or postal mail. Now, even though the courthouse is restricted, we have essential employees both inside and outside our facilities doing some crucial work. And we're trying to keep that population healthy, and so far so good. I'd like to take a moment to thank our Tulsa County road crew staff who continue to conduct emergency road and bridge maintenance and repairs. We're asking these essential employees to adhere to the social distancing practices. So remember, this won't last forever, and pretty soon we'll all be complaining about all the orange cones out on county roads. And the Tulsa County Treasurer wants to remind everyone that property tax due dates were extended several weeks ago to April 30th instead of the standard March 31st due date. Now remember, the Treasurer's office is closed to all public access, but there are employees available to answer your questions by telephone. Your taxes can be paid by check delivered via postal mail, or you can pay online or over the phone using a credit card, debit card, or electronic check. Payments may also be placed in a drop box. It's at the top of the stairs on the 6th Street entrance to the courthouse. It's located on the south side of the building. You can also visit the Treasurer's website, treasurer.tulsacounty.org, for more details and contact information. And more good news, the sheriff again reports that our jail population is still free from COVID. So far, so good. I'm so grateful for all the efforts taken in advance to make sure that this population stays safe. And an update regarding our old Juvenile Justice Center location. This building is being thoroughly cleaned this week, and training for additional staff is underway. And they're hoping by the first of next week that they'll be able to move some of the population from the day center and the Salvation Army into that facility. We're hopeful that our old facility can help address the current overpopulation and create some much needed social distancing. And the Tulsa County Carpentry Shop is making these UVC boxes to help sanitize masks for reuse. And these will be especially helpful for places like the Family Center for Juvenile Justice. And by the way, last week I mentioned some county employees were making masks for juveniles. Well, yesterday, Thora and Dana delivered 50 more masks, and their handiwork is much appreciated. So thank you guys, I appreciate it. And then Tulsa Regional Chamber set up a Get Help button on their website for COVID-19 resources for area businesses. In addition, they are hosting the Business Support Series every Tuesday and Thursday at 11 a.m. to help businesses get through this difficult time. So check the Chamber's webpage for more information. And lastly, a bit of good news for all of us concerned about potential flooding. As the mayor said, it's on our minds this time of year. As of yesterday around noon, the flood control pool at Keystone Dam was about 8.4% full. and the overall Arkansas River system storage is at approximately 12%. We are in continuous discussions with our partners at the Army Corps of Engineers, and current rainfall predictions for the next several weeks look pretty good in terms of Keystone's ability to easily mitigate flooding. So let's all stay hunkered down, stay safe, and check on our seniors who may need some groceries delivered. See you soon.
Thank you, Commissioner Keith. Please stand by as we bring our speakers back online for questions from the media.
Our first question is for Dr. Dart from Fox 23. How concerned are you that, like in the Spanish flu in 1918, we will see another wave of COVID-19 this coming fall and winter?
I think that's a reality that we all need to expect. So I think what we learned today through our social distancing and what we're doing to break the chain of transmission, what we need to apply this fall and this winter, because we won't be past this yet. And even if numbers start to diminish now, even if we flatten the curve now, especially if this is a seasonal pathology of this disease, we'll be talking about this again in the fall and winter.
Okay, Dr. Dart from Fox 23. How many positive cases in Tulsa County are healthcare workers? Is enough being done to protect those on the front line?
So we're not separating that out. We're just looking at total cases. Our contact, of course, tracing lets us know what people do in the community and what their jobs are. But like I say, for this information, we haven't separated out who's healthcare and who's not. I will say that the hospitals and healthcare providers have really stepped up, have all reviewed their infection control protocols, are doing a great job of protecting their healthcare providers and people within their system, so that if they are dealing with patients who potentially have COVID-19, they're doing it from a perspective where they're protected, they're using masks, they're gowned, and they're using their PPE. So at this juncture, things are looking very good from that perspective. But I can't tell exactly how many patients are healthcare providers and how many are in quarantine.
Okay. For Mayor Bynum from Channel 8, President Trump said yesterday he has the ultimate authority on when cities and states reopen. Whether or not that's the case, are you concerned this could pressure you to lift restrictions too soon?
Locally, we've set the policy that we're really following the on-the-ground guidance of the Tulsa Health Department. And that's the most important source of information and guidance for me, because there's no one in the world who has a greater on-the-ground understanding of what we're dealing with in Tulsa. And also, the Tulsa Health Department is completely independent. They don't have to care what an elected official like me thinks they ought to say. They have the liberty to just tell us what the right thing to do is to keep people safe. So I understand. I mean, the president, of course, plays a big role in this, as does our governor. But when it comes to the real day-to-day decision-making on the ground here in Tulsa as to what we ought to do, I think the most important resource for all of us is the Tulsa Health Department.
Okay. Mayor Bynum from Channel 8, even after things reopened, are you in favor of new restrictions to prevent a setback, such as widespread testing of the general population or requiring people to wear masks in public?
So I think, there's two aspects to reopening. There's the legal one, which I think, the president was talking about yesterday. And I think you will see over time a gradual rollback of the legal restrictions that the state has put in place and that I've put in place here at a local level. But the most important change isn't going to be a legal one. It's going to be the level of comfort that people feel in going about their lives as they knew them in February. And to do that, I think we have to have strong public health practices in place that give people confidence to go out and about. Now, as to exactly what the details of those are and what those look like. I think that's a discussion that we need to have as a community over the weeks ahead, because we want it to be, a series of practices that give confidence to everyday people. And whether that's wearing masks or, I've heard some talk about, occupancy limitations on restaurants in other cities, whatever that might be. I think we're open to looking at those different practices and identifying what's best here in Tulsa. I will also say that we, just as I feel very strongly that we benefited from being impacted by this virus by a couple of weeks after coastal cities were impacted by it, and it allowed us to react more quickly in the overall cycle of the virus hitting Tulsa, because we could see what those coastal cities had done, what they've tried out, what worked, what didn't. Whereas they had to largely develop it on the fly for cities in the United States, we were able here in the middle of the country to look around and see what other cities were doing that worked. We're definitely keeping an eye on that as cities start to ramp down some of their social distancing practices. I think a key thing, though, for everybody to keep in mind is, as Dr. Fauci said over the weekend, there isn't a light switch flip and we just all go back to February and everything's like it was in a day. That would be extraordinarily reckless and could risk everything that we've done for the last month, all those sacrifices people have made by overloading our healthcare system. So I think what you'll see, just as we ramped up restrictions, I think you'll see a gradual ramping down of them in concert with the guidance that we get from the Tulsa Health Department. And we'll monitor contagion rates and hospital loads as we do that ramp down to make sure that we're not going too far too quickly and doing something that endangers lives in Tulsa.
Okay, Dr. Dart from Fox 23. With our peak now beginning, does this mean I'm more likely to get the virus right now than I was last week?
Not really. It's an indication of our ability to do greater testing, and in fact, our capacity has gone up. Plus, it's also a reflection that people have been social distancing. So we're seeing that number, that what we call the R naught, or the reproduction number, actually go down. So while we're seeing the fact that one person might infect less people, the fact that we have this data allows us to look at things cumulatively. So the data is telling us that from a cumulative perspective, we're bound to see our greatest numbers this week. We'll see if that changes after these next 7 to 10 days go by.
Okay, Dr. Dart from Channel 6. South Korea has reported recovering patients getting reinfected with the virus. Is this something on your radar? Is this strain similar to other viruses?
It's absolutely on our radar. And here it's really unanswered questions. I mean, we still don't know if people are just having a relapse or if there has been a reinfection. We're still learning more about the antibody that's created from people being exposed. So, and whether that antibody stays, whether it wanes, whether it goes away. So there's a lot of unanswered questions here. And so we're paying attention to everything that's happening as much as possible all over the world, so that we can make the best decisions here and do the best we can to keep our residents here safe.
Okay. Mayor Bynum from the Tulsa World. When do you expect to decide on whether to extend the current shelter-in-place order, and what factors are you looking at as you weigh that choice?
So our current shelter-in-place order runs through the end of the month, and we'll continue to monitor the data from the Tulsa Health Department and from the state on how things are looking over the next couple of weeks. The threshold that the health department has given me that we need to be looking for is that we can really start to talk about and think about ramping things down after we have a strong degree of confidence that the daily hospitalization rate has peaked, and that moving forward our healthcare system can handle the number of people that need to get through that system. So we'll continue to, we know based on modeling that we think the infection rate will peak this week, but the health department has an outstanding team there in place who are experts in analyzing the data that comes in on this. And we're going to continue to follow their guidance and advice on what we need to have in place and how long we need to have it. So between now and today is the 14th, sometime in the next couple of weeks, we'll make a determination on how long or if we need to extend shelter in place.
Okay, Mayor Bynum from Channel 6. How big of an impact is the sales tax hit? Some other Oklahoma cities have had to lay off employees. Do you anticipate that in Tulsa too? And what concerns do you have going into 2021?
So we expect the sales tax hit to be significant, and that's largely based off of modeling that we do. You can look at regional employment as one of the greatest indicators of sales tax growth in Tulsa, and you have record unemployment right now. So that bodes poorly. Another great indicator for us, a leading economic indicator, is the price of crude oil. That is also in the cellar right now. And so everything points for us towards a very difficult financial time moving forward for the city government. The Brookings Institution just issued a study yesterday that says of all the cities in America, both Tulsa and Oklahoma City would rank in the top 10 as far as most vulnerable to an economic impact from this event. And that's largely because we're in the only state in the nation that requires sole reliance on sales tax for revenue. And so we don't have the kind of diversification that other cities can rely on to help them avoid the peaks and valleys that we go through here in cities across Oklahoma. The thing that we have now, though, that we did not have during the Great Recession is a rainy day fund. We created that after the Great Recession, realizing how useful it would have been to have it. And the city council and I, over the last couple of years, have been very aggressive in putting funding into that. We've tripled the size of it over the last 2 years. So we're in a better place now than we would be if we didn't have it. But that can only help in the short run. A rainy day is not a rainy year or a rainy decade. And so we're going to monitor and be very conservative about what we think our expenditures will need to be moving ahead in the coming fiscal year. And when I present the budget to the city council, my budget proposal to them on Wednesday will be very clear on exactly what we're expecting or preparing for in the year ahead. But in my mind, it's much more important to be as conservative as possible on the front end. And that's how you avoid the layoff situation midway through the year. And so at this point, at the city of Tulsa, we already immediately put in a hiring freeze when this event started. We banned employee travel right when this event started. We already had a rainy day fund in place. And so we have these different systems that can help us. So we don't, at this point, see a need for any layoffs of staff, but we're also not hiring additional staff.
Okay, Fox 23 from Mayor Bynum. We've seen an overwhelming number of small businesses reaching out for our aid. How has the response been to the Tulsa Responds program? And is there enough money for everyone who applies to get help?
So the TulsaResponds.org is what I encourage any small business owners who need assistance to go to that. And the response, as you can predict, it has been tremendous. The good news is that we've been able to assist a lot of individual businesses with direct loans. And I think we'll have an update on Thursday or Friday around what that looks like, what those numbers look like. But because of the money that the city of Tulsa put into the Resilience and Recovery Fund, we've been able to make loans to businesses that will tide them over until federal SBA funding becomes available. I think of equal and potentially greater importance, though, is that We also, if people call or reach out to Tulsa Responds, we have navigators there that can walk you through the state and federal options that are available to you there for funding. And the pools of funding, especially on the federal level, are so vastly greater than anything that we could ever offer from a city standpoint. And so it's great that we have a team in place that can help individual business owners navigate what can be a complicated landscape. You don't have to be, as a business owner, an expert on federal funding for small businesses. We have those in place. All you need to do is reach out, and we have the people there that can help you access those funds.
Okay, Dr. Dart from the Tulsa World. There will apparently be random tests of Oklahomans for COVID-19 antibodies to gauge how widespread the virus is in the state. How will that work? Will the Tulsa Health Department be seeking people to undergo testing for the presence of antibodies? And how will this coincide with private antibody tests, such as those being offered in drive-thrus?
So for example, the Oklahoma Blood Institute is reaching out to former COVID patients right now to actually collect their plasma to be used in treating this virus. And we're actually trying to really get a feel for who's expressed a desire to do antibody testing, who's doing antibody testing, and how we can do this collectively so that we can get the results back and get a really good feel for what the penetration has been in our community. So we're early in that planning process. We're excited that the Oklahoma Blood Institute has started to do some testing of and taking plasma from patients who have produced antibody. This will be used for treatment down the road. So there's positive things happening in that area where we'll have our hopefully plan in place in the next 2 weeks for what antibody testing would look like. There's lots of partners who are wanting to engage in this. We just have to make sure that all these dots are connected and there's more of a systematic approach to doing antibody testing as opposed to a scatter shot. So we have an idea and a feeling for really how has COVID affected our community, where is it, and more importantly, where is it not?
Okay, our last question is for Mayor Bynum from Fox 23. Did the city get anything in the CARES Act that it wasn't expecting and was surprised to receive? Or did the CARES Act have something we needed and we are getting it?
We have a team at the city that is actually analyzing the CARES Act and is working to process what those funds could be utilized for. So that's all something that's still very much being processed by our team because it's such a large bill and such a large amount of money. But we're very grateful for the assistance that it's going to provide, especially I'm hearing a lot about what it's going to be able to do for our public transit system in Tulsa and other areas of expense at a time, as I mentioned earlier, where we're seeing and predicting sharp revenue reductions. So I can have a better update for you on Thursday relative to the CARES Act than I can give you at this moment.
Okay, thank you. At this time, that concludes our press conference.